Here's an example on slide 18 of thermography. And you can see the different coloration of the right upper extremity, the hyper intense redness color, giving you the findings of reflex sympathetic dystrophy. Sympathetic blocks. There are basically three reasons to consider sympathetic blocks. Number one, may provide a cure or partial remission. In fact, I find that a sympathetic block very early on in the diagnosis of RSD can very well provide a cure, and is one of my number one treatment methods to have for the patients, no matter what stage they're in, but especially if you catch them in early, I like to do that sympathetic block. Number two, it provides further diagnostic information, and it helps determine what portion is being caused by the sympathetic nervous system, such as what is sympathetic mediated versus sympathetic independent of the sympathetic nervous system. And number three, the response to the block provides prognostic information about other treatments. Again, if the patient is getting a good response from the block, we know that it's mediated through the sympathetic system and it's maintained through the sympathetic system, and that further treatments that are blocking the sympathetic system will provide further benefit. Whereas if we're getting a poor response, maybe the continuation of the symptoms are not that of the sympathetic system, but are being maintained and are totally independent of the sympathetic system. Another procedure that is commonly done in some doctors' offices is the intravenous Patola Mingguang injection. It's simple and relatively inexpensive to do. It does provide a very sensitive confirmation in the early stages. The test determines whether or not the patient's pain is maintained by the sympathetic nervous system, because this is a direct block on the nervous system. The drug blocks the sympathetic receptors from receiving the circulating norepinephrine and the epinephrine. These are neurotransmitters, part of the sympathetic nervous system. And finally, the patient's pain will disappear if the receptors are blocked.
A little test that we use in our clinic is the Mcp Squeeze Test. All you have to do is grasp the MCPs and squeeze, and it's a very light squeeze, just a comfortable amount of squeeze, and they have an extreme pain reaction very often in RSD. Even when the RSD comes from a thumb injury, a finger injury, a wrist injury, there's something about the MP joints that causes a very tender, extreme reaction. So that squeeze test is very often positive over the MCP. So it's just another quick down and dirty tool that you can throw in your toolbox to use when you're assessing somebody. Response to cold is another thing you want to assess. If you touch the patient with something cool, they'll often have a noxious response to this. This is another hallmark to neuropathic pain. Very common with sympathetic maintained pain. The drop and swipe test that Dr. Barris mentioned quickly is also a very quick assessment and easy to apply. I'm going to go ahead and show you how this test works. It was designed by the Mensana Clinic in Maryland. It's very simple and easy to perform. I don't think that there's necessarily any literature to back it up. However, we've used it in our clinics and have had very effective responses to it. Very often you can just use the alcohol swabs that are already done. Sometimes you need to use a cotton swab with alcohol. We'll see how much alcohol is in this particular swab so you can see how it's performed. You just pull out the alcohol swab, and you're going to ball it up and have it squeezed so that you drop some of the alcohol. You might want to zoom in on this dermot. Drop a little bit of the alcohol on the affected limb. Then you're going to wait for the reaction. You can see me dripping it here. I'll do another one on the other side, because you'd like to do dorsal and volar both for the assessment tool. So if you take a look here, I'm going to do that. And you're looking for the reaction. Give it 10 to 60 seconds, see what they feel. If they have a dramatic increase to their pain, that can be thermal hyperalgesia. And if they just get a cool response, like I felt, oh, that feels cool. It's kind of almost a chilly response. That's normal and not thermal hyperalgesia. That's the first part of the test. The second part of the test will also demonstrate for you. You're going to swipe the alcohol pad lightly over the affected area. And if the patient responds with an increased pain response, or by pulling it away, then that's a positive sign. And you can do dorsal, a quick swipe, and as well as volar, a quick swipe. If they do that quick response of pain or jerking, then this patient has experienced mechanical hyperalgesia. And most CRPS RSD patients will experience some type of thermal or mechanical hyperalgesia. The nice thing is the test is very inexpensive, 5 cents or less. So you can do it and you can use it as a reassessment tool to see how your patient is progressing. So it's just another quick down and dirty assessment tool that you can utilize in your clinic. And if it works, that's just fantastic. It's just another way for you to document.